Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing in the NCLEX. Today's focus is on cardiac telemetry camp and cardiac lecture number 48, H's and T's. What is it? Well, when there's an organized rhythm check and you check for a pulse and there's no pulse, think the H's and T's. From my sticky note found on Nursing Camp, Facebook, Instagram, Pinterest, where you can download it here. And what I'm talking about is from this sticky note and the H's and T's. So the H's and T's. All right, so let's talk about them. So H. So when you're in a code and the person has, say, for example, VTAC, okay, and then you end up checking for a pulse. There's no pulse. So then all of a sudden you're doing CPR. And then what happens is you shock this rhythm. And then perhaps the patient then shows up in a organized rhythm. You see normal sinus, okay? Or you see AFib, or SVT, not a great SVT, or a flutter, or you see sinus Brady. Okay, or sinus tach. Okay, anyways, they're all organized rhythms. Whenever you see an organized rhythm, the first thing you think is, do they have a pulse? Okay, if they have a pulse, then you monitor ABCs, airway, breathing, circulations. But if there is no pulse, okay, then you evaluate your H's and your T's. And then you basically go down. You look at the patient's history. The first thing we think about is hydrogen ions. Have they been acidotic for a very long time? And treatments for that is sometimes bicarb. So we try to treat the underlying cause. We might still, ventilate that patient and put them on a vent, but we'll draw an ABG and we'll evaluate, and we might give them some bicarb and try to correct their acidosis. The next is hypokalemia. Oh, that's supposed to say hypokalemia. Hypo. And that makes sense because there is no fluid on board. So if you were to feel for the pulse, for example, you wouldn't feel for a pulse. There'd be no pulse, but yet the heart is working normally. Okay, so the correct treatment is normal saline. Bolus them with fluid and hopefully fill up the pump. And that makes sense that they wouldn't have a pulse, but there's nothing wrong with the heart. It's underlying. And that's the big thing about this. Hypoglycemia. Well, that was actually taken off the algorithm for ACLS, but people still check for sugar. So blood sugar less than 60. Okay, and that you give D5, D50 IV. Hypoxia, so that's a patient who's been hypoxic for too long. That would cause them, nothing wrong with the heart, remember, organized rhythm, but there's no pulse during cardiac arrest. And so we would correct that with airway. Next is hypokalemia. Well, hypokalemia, I covered in another lecture about potassium. Now, low potassium is slow. And what that means is slow respirations. And everything's bradycardia. Everything slows down with low potassium. So you would correct with potassium. Remember, never greater than 10 milliequivalents peripheral and nor greater than 20 milliequivalents an hour through a central line. Please see my potassium lecture. All right, hypokalemia, okay, because of, we talked about peak T waves, right? So you might put them on monitor and you see, and a T wave is like that. So peak T wave, so we call in the king for that. We might give some K-exolate, soupy poopy, give some insulin, and glucose. Please see my potassium lecture on that. This is also given for hypermagnesium. And anytime there's an electrolyte problem, generally. high electrolytes. The next is hypothermia. We actually cool patients when they have MIs, and to protect the heart. And it's also because it slows everything down. And they wouldn't be able to have a pulse if they were hypothermic, because everything is slowed down. But they may still, their electrical activity still might be there. So they might not have a pulse though. So you'd want to warm that patient up. The next is your T's. So H's are all things that could be causing no pulse. Now the T's are also reasons that they have no pulse. That's trauma. Okay. Are they bleeding out on the inside? They have no volume. Okay. Or it's tamponade, right? Like with cardiac tamponade, where you have so much fluid built up around the heart that the ventricle is collapsed and it's no longer pumping, no cardiac output. So when you feel a pulse, you get pulsus paradoxus, one pulse over here and no pulse over here. So tamponade can cause that. Also flail chest, if they're bleeding out inside, it's affecting the heart somehow. The next is toxins or tablets. More specifically, benzodiazepines, like Ativan, Valium, benzos. And the antidote is romazicon, or flumazenol, the problem with that, giving that, is it sends them into potential seizures when you reverse that. See my lecture on benzodiazepines to see that. Then the other toxin could be other just overdose medications, or opiates. And the antidote is Narcan for that. So just to think about it, as far as why they might not have a pulse. The other one's tension pneumo. That kind of goes with tamponade, where in the chest you're having such a built-up pressure that it's collapsing the heart, and that heart can't pump out because the lung is filling up with either a pneumos, ear, or hemothorax, which is blood. And the last thing is they got a big clot lodged in the heart or in the pulmonary tree, and that's a PE. And that person is in pulmonary artery, so they can't give you a pulse because there is no blood flow. It's backed up. All right. My name is Kevin from Nursing KAMP.com, and these are my sticky notes covering the H's and T's. The next lecture, I'm going to be covering cardiac blocks and what you need to know for the NCLEX and ECG. All right, we'll see you next time. Nurse on.